Okay, so we are going to quickly go through how to draw blood from our new Gripper Plus Huber needles. So after we've got the site accessed and the sterile dressing covering, we will use a 3-way stopcock if we need to do blood conservation. So if the patient is low on blood or has frequent draws, we would want to use the blood conservation method. And again, this port is on the new Gripper Plus needles, this needle port, and we are not going to use that. We're going to pretend like that is not even there, and we're going to be using this distal port. So first I'm going to gather my supplies. Before I gather my supplies, I'm going to look in policies and procedures on the vascular access grid. If you just go to SLHS policies and procedures and search for vascular access grid, it will tell you how many mils you need to flush before you draw, how much waste you need, and then how to flush after you draw. So I've looked that up, and for my pre-flush for a port, I need to flush with 5 mils. I need to waste 6 mils, and then after I'm finished, I flush with a whole syringe, 10 mil syringe of normal saline. So I've got that prepped in my head before I start. I'm going to use my 3-way stopcock. I'm going to use a vacutainer collection device, my blood tubes, and then my flush. So that, of course, I'm not going to have it opened up yet, but just for the sake of the video, I will go ahead and scrub my hub for 5 seconds with ChloraPrep, 15 seconds with alcohol, and I will, at that point, uncap and prime my flush. I will take my stopcock, and when I take it out of the package, it looks like this. It's turned off to this side. I'm going to be, I want to go ahead and prime this port that's going to go connect to the patient. So I'm going to take that cap off, and I'm going to take my cap off that goes to my syringe. So, oops, I got that backwards. So I'm going to put my syringe, and I'm going to prime. I'm actually going to turn off to my blood side and prime the side that goes to my patient. Okay? And I would have probably done that first, and then I would scrub my hub. And then I will connect. And so I'm off to the blood side. And again, according to that grid, I would flush with 5 mils of fluid. So I'm going to flush with 5. And I've got more than 5 in here. And then it said I would waste 6. So I'm going to aspirate back. Oops. And I'm going to have to manipulate my little blood bags back here, sorry. Oops. And I'm going to waste. And you would get on a real patient, hopefully, your blood back and not all this air. So you see I have air in there, but you're going to waste back till you get to 6. At that point, I'm going to turn it off to my waste. I'm leaving my wasted blood. This will be full of the patient's blood. I'm going to leave that connected. And then I will take my red cap off and attach my vacutainer access device. And I would put my blood tubes on, whichever ones I need, and collect my blood. And again, I'm getting air, but that's just because of the mannequin. So once I get all the blood tubes collected that I need, I would turn my stopcock off to the blood, give my waste back, and I would keep the air up, as I want my syringe up to keep the air up. So I'm going to give my patient all of their blood back. And at that point, I can disconnect from the patient, and I would scrub my hub again, 5 seconds for ChloraPrep, 15 for alcohol, and then I would get a pre-filled syringe with 10 mils of flush and flush one more time according to that grid. So that is how you obtain blood using your 3-way stopcock from an implanted port.